in this quick video, we're going to be looking at an area of research methods, which is really looking at the implications of psychological research for the economy. So what impact is psychology having on the wealth of the nation? So first up, what do we actually mean by economy? The economy is the state of a country or region in terms of the production and consumption of goods and services. In other words, it's really about resources and the allocation of resources. A lot of it has to do with employment and public spending. So the question for psychologists and for us is really, how can we apply what we learn from psychological research to benefit and affect or devalue our economic prosperity? So in what ways can psychological research better or harm our economy? So I guess we want to focus on the positive. So how can research from psychologists increase economic growth? Well, it can lead to greater cost effectiveness and increased production. So a lot of psychological research leads to better ways of managing people whilst they're at work. So if we've got a better understanding about what motivates people and what makes them happy, then it means they're going to be more productive, which means they're going to be producing more goods, which can be sold, and that's then going to have an effect on the economy. So for instance, research into motivation, stress, all of these can be used to increase productivity. Likewise, research from psychology can create energized, motivated, productive, happy and healthy workforce. So I think this is quite an alarming statistic that about £15 billion a year is spent on the absence of work. And a lot of these absences is due to mild mental illness. So people suffering from stress and anxiety take sick days, and that needs to be covered somehow. Either the business is going to lose productivity, they need to pay somebody else overtime to cover that shift, for example, and this costs taxpayers $15 billion a year. So psychology can conduct research into what motivates people, how to make people happier, how to make people healthier in terms of both their physical and psychological health. And this is going to have a direct impact on the economy. It can increase the workforce. So for example, we've looked at a lot of research into the role of the father. So if we think that the father can take on the role of a primary caregiver, it means that now you're freeing up half the workforce or women to take on roles that will help stimulate the economy. So if women are back in jobs, then they're paying taxes, and this is creating more revenue for the government to then spend on spending. However, if both parents are working, then the costs of childcare is also going to impact on the economy. And if the government has to subsidise that, then that's something that we need to look at as well. So we can increase the workforce based on research into attachment, research into psychopathology, etc. We can better offer different goods and services, so we have a better understanding about, for instance, what consumers like and what is good, and therefore we can offer better goods and services. Better leaders and recruitment policies, so if we understand, for example, about different personality traits and what makes somebody successful in a particular role, well then we can save money on recruitment. We can make sure that we're targeting the right applicants the first time and that we're retaining them. We're making sure that they're staying in the jobs that they're good at and productive in. And so we can develop training programs and better HR policies to get the right applicants and to make them excel in their jobs. Psychological research could lead to better educational outcomes for children. You know, if we're looking at research into cognition and cognitive development, we're really asking, how do children learn? And how can we use techniques that will help better improve their educational experience? So, for example, research has been applied in Sweden and some of the Scandinavian countries that says there's no point teaching children anything before the age of 7. They should just learn through play. And if you look at all of the rankings, you know, Sweden outrank every single year every other country in the world by having the best educational outcomes. Their children are more literate, have better math skills than almost anywhere. And so we really need to look at what works and how can we actually implement that in schools. We can save public money and resources. So, for example, if we can better look at the reasons why people develop particular mental illness, then we can take steps to preventing that. And that means that people aren't going to be ending up in emergency wards throughout the country. We're going to be able to intervene earlier to prevent it from getting that far. And likewise, if we can have early interventions, it means mental health services aren't going to be overwhelmed. And it means that they can then allocate their resources into other areas. Beyond that, though, you know, if psychology is creating and publishing cutting-edge science, then people from overseas are going to invest. You know, if we're producing interesting results that are going to have implications for different industries, then people want to get involved. And it means that overseas companies might be investing their resources into this country. And finally, this is basically like the work of the Nudge Unit. Those of you that are interested in behavioural economics will be aware of this. This is an old government agency that was using psychological principles to encourage people to engage in positive behaviours like increase recycling or exercise more or pay their taxes on time. And in that last example, you can see how that would directly affect the economy. So we can apply psychological research to encourage positive behaviours that might reduce public spending. So for instance, if we can encourage people to exercise, then there's going to be less of a burden on the NHS. We'll be able to save money because people aren't going to be admitted for cardiovascular disease at the same frequency. And so we can use these principles to help really nudge people in the right direction to make better choices for their health, and for spending of their money, for example, so that money from the government can be allocated elsewhere. So I just want to take you through two specific examples of areas of from this specification. We're going to look at stress and we're going to look at forensic psychology. And then later on for homework, I'm going to ask you to do the same exercise with a little bit of extra independent research to the other areas of the specification you've studied this year. So let's take stress, for example. Now, understanding of stress is really important. This has a big impact on the economy. Increased levels of stress influences people's ability to work effectively. So research shows how people cope with workplace stress. So for example, if they've got lack of control over their work, for instance, if they're working on a factory assembly line, that lack of control can actually increase levels of stress. Likewise, deadlines, lack of autonomy over their work, lack of choice over how they spend their time and whether they've got flexible working conditions. All of these things are useful for companies to know. If we can alter our workplace so that we can increase productivity, it means that the workforce are happier, healthier, better equipped to deal with stress and are going to be more productive. So, for example, stress and depression are the leading cause of long-term absence from work. And it costs a huge amount of money for people to be just away from work for a long period of time. And stress and depression makes up 30% of all lost working time. If we can find a way to make people happier and more motivated at work and less likely to experience work-related stress, then this is going to have a direct impact on the economy because it's going to make them more able to go to work. That's going to require less company resources to pay overtime to those covering the people that are absent, for example, and will just contribute more to the economy in the long run. We could also have a look at the health consequences of stress. So understanding the fight or flight response, understanding what happens when the HPA or hypothalamic pituitary adrenal system, this is basically our sympathetic nervous system, understanding when this has been activated and the risk and impact this has on our bodies can mean that we can understand the stress response. And we can use this to our benefit. So we know that stress increases the risk of cardiovascular disease, stroke and diabetes. For instance, fight or flight response constricts our blood vessels, makes our heart beat faster, makes sure that blood and oxygenated blood is flowing through the body. But all of this can really take its toll. Likewise, we know that there is a psychological impact of stress as well. So acute stress, frequent acute stress, or chronic stress over a long period of time can lead to depression and anxiety. But if we understand the impact that stress has on our bodies and our psychological health, then we can develop appropriate interventions. We can prevent people from getting ill, we can prevent heart attacks, we can teach people how to manage their stress so that it's going to lower the costs associated with resourcing the NHS. Basically, we want people healthy, happy, working, and not being a burden on public spending. All of that combined means that psychology has a positive impact on the economy. So when you're investigating the different areas of the specification, it would be really handy to have some useful statistics like this. You know, what is the cost of mothers having to stay at home to look after a child rather than continue in work and get the promotion and pay taxes and pay into her pension, for example? For psychopathology, what is the cost on the various different drug treatments, for instance, CBT versus drug therapy? And who's paying for that? And what impact is that then having on the economy? And if it's a short-term treatment that somebody needs to take for life, as in the case of drugs, what burden is that going to have in comparison to CBT, which equips people with the skills necessary to cope on their own after some period of time? So really consider the statistics, have a look at how much is spent and how much is wasted on different areas. And then have a real think. You might need to think creatively and do some research, but really think deeply about how psychology can be used to positively benefit these areas. What might we find, or what have we found about behaviour and the mind and the brain that's going to lead to a stronger economy for the UK?